All right, so we've been working on a way to try to treat infections on medical implants non-invasively. There's not much of a danger from medical implant infections, but when they do occur, you have to have a second operation to remove the implant and replace it. And our particular focus so far is on hernia mesh repair. And so it's a relatively easy target. We're hoping to move on to like artificial heart valves or heart assist devices that are much more serious if they get an infection, because you need a second open chest or open heart surgery. And so the idea is we send an ultrasound at very high intensities to destroy the bacterial biofilms, which is a protective matrix that prevents antibiotics from being effective and can also lead to the development of antibiotic-resistant strains of bacteria. And so we treat those bacteria with high-intensity ultrasound that breaks them apart, fragmenting the cells in the process. And we are able to do this through the body wall without needing to do invasive surgery. And so once we've perfected the technique for treating mesh infections, we're hoping to move on to other implants and other infections as well. So my research is on medical ultrasound, and recently I broadened out to ultrasound more in general, like an ultrasound for non-destructive evaluation applications. And in the medical ultrasound, we have, of course, improving the diagnosis of various medical conditions like ovarian cancer or cervical ripening, which would be a predictor for preterm birth, or the risk of premature birth. And on the therapy side, we're trying to treat diseases. And so we're looking at treating cancer as well as treating bacterial infections. And one of the methods that we're focused on that is called ultrasound histotripsy, or cavitation-based histotripsy. And that's where you excite a cloud of microbubbles in the tissue, and they are responsible for destroying or fragmenting the cells through mechanical action. The more common method of doing ultrasound therapy is heat. You basically send in energy, and you have it focused on a particular location, and that tissue gets warm and gets cooked. And so that's how most applications work. But histotripsy has some advantages. One, it mechanically destroys the tissue. It has a little bit finer boundaries. It's easier to visualize the therapy and the effects of the therapy in an ultrasound imaging system. The thermal applications usually require an MRI system, which is a lot more expensive.